100600344. Today I will be performing a video on the safe application and safe removal of PPE. As we know that PPE is required to look after someone who is a suspected case of COVID-19 or for the droplet precautions. So the equipments we would require during the care of a COVID-19 case would be a gown, a surgical mask, goggles and the gloves. And we will be performing hand hygiene at each and every step so that there is no contamination, and all the PPEs would be required to dispose into a clinical waste bin which is at the side, and I shall proceed. Okay, I will be performing my hand hygiene for 2 minutes before putting or touching any of the PPE equipments. I'll make sure that my hands are clean enough to start. After cleaning my hands for 2 minutes with the hand sanitizer or the soap, I'll be putting on the gown. After putting the gown on, I'll be proceeding with putting the mask on. And I'll remember not to touch the inside or outer side part of the mask. I'll be touching the strings and putting them on. And I'll be adjusting the mask. I'll use my hand sanitizer again. I'll put the eye protection on and adjust the mask accordingly. And at the last, I will be putting my gloves on, and I will make sure that I put the gloves on the top of the gown. And after putting all the PPEs, I'm ready to go into a COVID suspected case, like a room for a patient to enter into the room. And I'll make sure that I explain everything to the family before I proceed. So I will be talking to the family as well as to the patient why I have the PPE on and what's the purpose of putting the PPE on. After taking care of the patient, I will be removing my gloves as well as the gown inside the room of the patient, and I'll make sure that I don't touch outside of the gloves. After removing the gloves, I will be doing my hand hygiene first, and I'll remove the gown inside the room, and I will dispose it inside the room before I leave the room. I'll make sure that I don't touch anything from outside. I'll do my hand hygiene again, and I will get out of the room, and after coming out of the room, I'll remove my safety glasses. I'll do my hand hygiene after removing my safety glasses again, and then I'll make sure I remove my mask without touching the mask from the outer side or the inner side. After removing the mask, I'll make sure I wash my hands for 2 minutes again. So this was the demonstration of safe application and safe removal of PPE. Thank you.